Hi, I'm David Dumbroski, the Center Director for the Novus Center. And today, we're going to be answering your questions about using extracorporeal shockwave therapy for erectile dysfunction and Peyronie's disease. The clinical term is low-intensity extracorporeal shockwave therapy. It's a sound wave dialed in at a therapeutic dose that makes tissue healthier. How does it do that? It creates therapeutic microtrauma, signaling your body to come in and heal and make the tissue healthier, stronger. It also creates new blood vessel growth. We call that angiogenesis. It can also break up scar tissue and the plaque that develops in our blood vessels. Shockwave can do a lot of different things for the human body. There's all kinds of treatment protocols for things like plantar fasciitis in the feet, other body parts. We do many of these things, but we also focus on the penis, erectile dysfunction, lack of sensitivity, Peyronie's disease. That's what shockwave can do, is can make those things better by creating new blood vessels, healing nerves, better sensitivity, bigger, stronger erections, healthier tissue. Shockwave, typically for most men, is a 30-minute treatment done once a week. The number of weeks will vary depending upon you and your condition, which is what we have a consultation for at the beginning of your treatment protocol to determine. But when you're actually having the treatment done, we do have you apply a desensitizing numbing cream just to kind of take the edge off. It's not really painful, but we want to make sure that you're comfortable. And then it is a treatment where the provider is slowly moving this device that's creating the sound wave across the shaft of the penis and the surrounding tissue to do all those things we mentioned before. We get this question all the time. Now, we do have you apply a desensitizing numbing cream just to kind of take the edge off. Without that numbing cream, the easiest way to describe it is if I shot you with a rubber band. Is that pain? Most guys go, it's not really fun. If I shot you for half an hour straight, would you like me very much? Most people, not so much. So the numbing cream just takes that edge off. When you have got the numbing cream on, you're not feeling anything, you're free to have a conversation with the provider while you're having treatment done. Great question. Again, we get this question all the time. Beautiful part about sound wave therapy is there are no side effects. There's no downtime. You can have sex the same day as treatment. But every now and then, guys will report maybe they have some light bruising. That's not a big deal. Goes away in a day or so. Yes, in fact, we encourage more sex. Anything that brings blood flow into the area, sex, masturbation, erections. We even provide you with a penis pump as part of the treatment protocol to just increase that blood flow and get you better results. So more sex as much as you can. The national average success rate is around 75–80%. Here at Novus, we do not accept every patient who calls us up. We actually push guys away who are not good candidates. We don't want to give them false hope and not be able to get them results. So we really only work with guys we know we can get good results with. So that pushes our average up north of 90%. Another great question that we get all the time. One of the ways that we determine if you are a good candidate is we do a phone consultation before you even come in here. And we get very thorough with your health history. We want to make sure we understand whatever medications you might be taking. Are you diabetic? Do you smoke cigarettes? Things like that. Now, just by saying yes to some of these does not mean you're not a candidate for care. There's degrees. There's diabetics who take care of themselves. They have their A1C that's very good number. It's handled. They check their blood sugar. They take their meds. And then you have diabetics on the other end of the spectrum who don't have any idea. They don't check. It's out of control. So we're going to try to figure out where you are to determine if you are a good candidate. But there's also things like substance abuse. And this happens all the time, guys. We are trying to be upfront to help you out. And I'll ask guys very directly, are there any things we need to worry about? Heroin abuse, meth use, things like that. Sometimes guys are upfront with me. Sometimes they're not. They'll actually start care partway through. They're like, oh, by the way, I smoked crack this morning or something like that. Happens more than you actually think. So we'd like to know this information to give you the best care. Unfortunately, no. The insurance companies think a little blue pill is all you need. But with that said, we do our best to make this affordable. In fact, we even have finance options. We've got the ability to check to see if you qualify without even doing a credit check. So to make sure you give us a call to see if this is fit for you. This will vary from patient to patient. Factors like how old you are, how severe is your condition, how well your body responds to treatment. So the number of treatments can be as few as maybe 3 if you're a 20-year-old something who's got a little bit of an issue or they kind of want to improve things. The other end of that spectrum can be someone who's 80 years old with some severe problems, their health is not great. That can be north of 6 treatments. The studies that they did chose 6 treatments as sort of the standard, but again, that will vary based upon you and your health. Everybody's different when it comes to the results that they see. On average, if someone's doing, let's say, 6 treatments, it's usually around the 3rd that guys start noticing some positive changes. Clearly that's the average, which means some guys it might take longer, some guys might see results in as few as 1 treatment. Don't expect that. Plan on usually around the middle of a 6 treatment plan, around the 3rd treatment or so. Everyone's different. Let's figure out what's gonna work for you. Another great question. Everyone's different. So what we tell people based upon what we've seen is the results that you get in the clinic, it's sort of up to you in terms of how long these results last. If you take care of yourself, eat properly, exercise, do all the things you need to do to take care of your health, the results can last years and years and years. If you're on the other end of that and you're partying too much and you know it, whether it's alcohol and smoking tobacco, whatever it may be, those results may not last as long, and we're getting a call from a guy a year later saying, okay, I effed up, I need to come back and do some more treatments. The P-shot can be a great procedure for certain guys depending upon your situation. A lot of guys will do the P-shot after they do a series of the wave treatments. Some guys will come in and just do 1 P-shot. It really depends on what you're looking to do and what problem you're trying to solve or what thing you're trying to make better. So give the office a call and/or check out our website or the links down below. We've recorded a lot of videos on the P-shot itself, and that'll answer any questions you might have, or we can do that for you on the phone. If you have any other questions that we didn't answer here today, go ahead and put those down in the comments below. Again, I'm David with the Novus Center. We look forward to seeing you soon.